and I've been doing some research at the University of Alberta this summer. So I will present to you today intrinsic connectivity network study of children with parental exposure using functional magnetic resonance imaging. That title is way too long, so I will explain part by part. First of all, what is fetal alcohol disorder? FASD, the acronym, is the leading known cause of preventable developmental disability amongst Canadians. It's 1% of Canadians that is affected by that. So it is a really a high proportion of children have this preventable disease, and I find it really bad in Canada, which is a developed country. The study is using 4.7 Tesla MRI scanner at the UVA, which is one of the strongest whole body magnets in Canada. I think there's only one other, which is the same strength. The development of magnetic resonance imaging has started in 1938 with nuclear magnetic resonance and has evolved step by step to today a really intense and advanced field of medical imaging. It's really useful and has a lot of application. The application I'm using is functional MRI, which is like making a video of the brain. That's really interesting. I will first explain a little bit what is nuclear magnetic resonance, the physical phenomenon underlying underneath MRI. In your body, you have about 63% of hydrogen, which is basically protons, and these protons have spins. These spins, when in a natural environment, are randomly aligned, but when you put a magnetic field on these, they will align parallel and anti-parallel to the magnetic field. Afterward, with well-controlled gradients of magnetic fields and radio frequency electromagnetic waves, you can reorient these spins and they will decay slowly to get back to their parallel and anti-parallel position. So you will get a signal, a radio frequency signal, like it's on the FM band, I think, depending on what kind of application you have, that you will gather to make a three-dimensional image of a brain, for example. And this image will be weighted by the time of relaxation of these processes. To have contrast in the image, you need to have two different types of tissues, and these two different types of tissues will have different relaxation time. That's how you can make the contrast between tissues and get nice images. There are three different types of relaxation time. They are called T1, T2, and T2 stars. I only use T2 and T2 stars. T2 is used in my study for anatomical images, so that's a high resolution of the brain. It's not a video, but the T2 stars is used because it has a really good contrast on small fluctuations of magnetic susceptibility. So it can measure the oxygenation of the blood. That's what's going to be used to map brain function. To get functional images are single images of the brain, three-dimensional of the brain, that are taken on time intervals of 2.5 seconds. So every 2.5 seconds, you can map the entire brain and start over and over again so that you get a movie, literally movie of the brain. From that, you can do stats and get interesting neurological information. That's the scheme of the blood flow between neurons. So when neurons are activated or deactivated, the blood flow changes and the glucose consumption is increased, and there's more oxygenated blood in the arteries, so that you can measure the oxygenation with the T2 star and get fluctuations on every voxel depending on what the person is thinking and what kind of network is activated. These are the kind of networks that you can get. So the yellow zones are all activated at the same time with the same temporal modes. So on the first two on the top are visual networks. They are related to areas related to vision. C is auditory, and you get also lateralized networks on the bottom. And there's a sensory motor network too, and a default mode network that is activated when you think about nothing or you sleep. These are intrinsic connectivity networks, and my study was to compare the correlation of these networks between two groups of subjects. The studies was, the participants of the study were children from 5 to 18 years old. Half of them, about 31 of them, had parental alcohol exposure, confirmed, and 36 of them were match control with age and sex to get a sample to compare the two groups. As I said, there was an anatomical scan with a resolution of 1 cubic millimeter and an acquisition time of 5 minutes 50 seconds, and the functional scan was still less good resolution, but you can take a time point every 2.5 seconds. So during 5.50 seconds, we acquired the 140 images. To analyze these data, you need to do a lot of processing steps. The first one was slice timing, because functional MRI is a really difficult technique. You need to acquire half of the slice, the odd slice, at a time interval of the odd slice. So you need to readjust the difference between these slides. So that's one, the pre-processing step. The second pre-processing step is motion correction, because the children were moving a little, but we can correct a little bit about that. Then we need to virtually extract the brain matter. So I have a nice image here. And you can do a three-dimensional view of this extracted brain. Then you need to register all the images to the same space. So all the brains are not the same. You need to find a common space to compare different brains so that you can do statistics. Finally, I did some smoothing to reduce the noise and filtering to remove the signals from the breathing and the cardiac rhythms. The last step was the statistical step. It's called probabilistic independent component analysis, but most of it is a mathematical algorithm that lets you get the eigenvectors of the brain video. So one of these eigenvectors, for example, is a temporal mode, and you can measure the probability of a single voxel of your video to be part of to have this temporal signal. So you get these networks, the intrinsic connectivity networks. This one in particular is a part of the visual networks. You can recognize the visual areas that are at the back of your head. I did this process for the two groups. First one, the PA, parental alcohol exposure, and the second one for the control. And then I compared the images. They are really alike a little bit, but you can see differences. So for the control group, the zones are not exactly the same, but you can recognize that it's the same network. And for the FESD group, you get a little bit less and a little bit more voxels affected by the same time series that is due to that is related to a mode network. In this case, it's the default network, a part of it at least. The second is the language network that seems to be affected, although and we need to do more analysis on the data that we still have. To conclude, future development, as I said, implies more subjects. We have collaboration with the Queen's University, and I think UBC University to get more children with PA functional data. We need to do numerical comparison. We need to take into account the parameters of the groups, like the sex, age, and any psychological tests that have been done. And for the impact of the study, it's a great way to study brain anomalies in general because it's a developmental disease. You only have the effect of alcohol in between the two groups, so it's a nice window of study in brain development. I'd like to thank my supervisor, Vincent Methot from the University of Alberta, two collaborators, James Reynolds and Armin Rasmussen, the NeuroDevNet that funds the FPSD research, and University of Laval for letting me come in here in the series. Thank you very much.
We'll take questions from the floor.
Yes?
Your fMRI collects a single image every 2.5 seconds. Did I get that right?
Yes.
So is it an average body activity within that 2.5 seconds?
Yeah, like I said, you analyze half of the image before it's going to happen. The body slices are separated by the event slice. So you cannot really get information on a lower frequency than 2.5 seconds, the inverse of 2.5 seconds. So the minimal time frequency resolution that you can get is depending to the analogous frequency higher than that. But the oscillating networks that I've shown, the visual networks, that's a good question, are really low frequency oscillations. So you can get this information.
Okay, would it be interesting to have a lower collection time?
It would, but the lower connection time is something like a third of a second, but you get a really, really bad noise, a really bad resolution, and you cannot really do interesting stuff. Yes?
Hi, I was wondering, because your subjects are from 5 to 18-year-olds, right? So the size of the brain is really different between those two. So how does that affect your data?
Actually, the first step I did was to get the intrinsic connectivity networks. So in between the groups and for the complete data set, I could identify visually these intrinsic connectivity networks, but it's sure that the age of the children is a really important parameter that we need to regress from these data, because it's not only the brain size, it's also the brain development, so it's all changing. But the brain size in particular is taken into account by registration. So when you want an image from one patient to fit the image of a second patient, you need to change the dimension with a 12 degrees of freedom, so you can translate, rotate, shear, and get it bigger or smaller. So the brain size is not that important.